what we actually have, the base of it, kind of what this product is, what we've seen in it, the research that we have done on this to understand why we're getting some pretty phenomenal results, and then try to just make sure everybody has a good feel for what this is doing. So first and foremost, the hops plant has been around thousands and thousands of years. Those of us in the healthcare world, specifically in some of the more natural-based stuff that we do, we've used this hops extract for many, many years. But what was interesting is when we actually look at the difference in the supplementation that's out there versus what's in our pHix product. And for me, when we got into the research, we started looking at there's two major classes of different substrates or elements that come out of the hops flower. And we're going to talk about the bitter resins or the bitter acids and what they kind of do versus the polyphenols or what I call the phenolitic side, which is what a lot of the other supplementations have. And as we dive into what these acids, these isoacids are that come from the hops flower, it's interesting because they are very unique in how they upregulate certain things in our body. So when we saw the research on this, we started looking at some of the potentiation that could possibly happen if this stuff did what we thought it was going to do, according to the research, we got real excited about it. Having been in practice, as Byron said, for over 40 years, I've never had a tool like what we now have with this product. And so I want to kind of just break down a couple little things about why it does what it does and the uniqueness, and why, because of that pathway that it gets into, we're going to see a multitude of different types of reactions that are very positive that we're seeing in the body. Now, we've been dealing with this product for over 90 days now, and have watched hundreds and hundreds of people and thousands around the world that are taking this product and seeing some of the results that happen. So I want to just kind of unpack that a little bit so we have some understanding why this is so unique that nobody else has, and why we're going to see results that nobody else is probably getting with any other type of a hops extract. First of all, this is a liquid bitter acid, right? And we will call this one of the three bitter resins that are there that have the alpha, the beta, and the gamma acids that are in there. And what's unique about that is when you put this in a liquid and you put it into your mouth, there are bitter receptors or sensors inside the human mouth that are actually there designed as a protective mechanism. So what does that mean? In the world, if we go out there and just eat things, in the natural aspect of that, there's maybe some things that are not good for the human body, and they will have a bitter aspect to them. So we have these bitter receptors or sensors within our mouth. And the moment that we put something in our mouth, we know whether or not it's good for us or bad for us. And generally in the old days, we would just spit it out. But with what they've done with food today, how they hide a lot of these things, the body tends to let it go ahead and be swallowed. So when we take this pHix and we put it in a drink and we put it in our mouth, immediately the bitter sensors open up and hit a receptor, and that sends a signal to our brain, and it hits what we call the vagus nerve, and it goes down to the stomach, and it stops things from going through so they can process what it is. Now, the moment you swallow that, from the mouth to the tongue, all the way down the esophagus, and even in the trachea, by the way, in the lung pathway, it opens up all these receptors and is trying to identify what we just swallowed. Now, the irony in that is that when it gets down into the stomach, it then hits another system that's called the brown adipose tissue, and that turns on a thermogenic reaction, which then goes and makes the white fat be broken down so that the body's immune system and its metabability, or its ability to break things down, has enough energy to go in there and break it all down looking for the poison. And here's where another funny thing happens. Since there is no poison, the body has massively produced metabolism to break all the foods in the stomach down, and it's burned white fat to make that process work. So when we saw this in the research and we understood that the brown adipose tissue was going to be upregulated and convert the white adipose tissue to break down for energy to go after this, we thought we would see some pretty unique things. And there's a lot of pathways that are based upon the metabolism and the utilization of fatty acids. I mean, from the brain all the way down to hormones, to the immune system, to your skin, your nails, your hair. The list is almost endless. And when we looked at the research on this, what we saw is that when you actually break down that white adipose tissue, and there's quite a few areas that it's in, I want to just touch on them briefly here. But the white adipose tissue is under what we call the love handles. I mean, there's another name for it. It's called the subcutaneous adipose tissue. Then we have the muscle adipose tissue. Then we have the visceral adipose tissue. Then we have adipose tissue that's in the brain, in the lungs, in breast tissue, and even in bones. And so when we looked at what happens to those fatty acids, we went back and in a functional medicine point of view, we said, okay, if we have bad fats in our body, we're going to get a term that's called fat rancidity. And that fat rancidity is going to cause a term called oxidation, which means inflammation. So one of the greatest things that we know the hops flower extracts do on both sides is that it reduces inflammation. So when we saw that this unique acid inside the pHix was going to go in and turn all these systems on and then break down all those free fatty acids that are rancid, we would then reduce inflammation. It's kind of like having a fire and you put the fire out. We're stopping the damage that's potentially occurring. So when we saw that this was going to hit those pathways and turn off all those issues, that means the body was now going to have enough energy to go repair the very systems that were inflamed. So when I looked at this phase of this, and I and Dr. Phil and a few of the doctors, we started discussing what these things were doing, we got real excited about that. So at this point, I'm going to turn that over to Dr. Phil, let him add what he wants to add in on that part as well.
Awesome. Thank you so much, Dr. Bowers. And I'm glad to be here today to share with everyone about what we're talking about here with this this very unique product, matured hops extract. You know, when I heard about it, I got word that this was coming. I said, well, I know all about hops. I've been, I've dispensed products over the years that contain hops and hops extracts. But this was something totally different, totally new. And I said, I got to do some research on this. So I started researching extensively, looking up every study, every article I could find on it. And when I started reading these, I got super excited because of what I was seeing. And like Dr. Bowers, I was thinking, if this does what these studies say it's going to do, this is going to be huge. This is going to make some, life-changing differences in people's lives. And one of the things that I had been researching prior to learning about the hops extract that we're talking about here was fatty liver disease, because I have numerous patients, clients that have been diagnosed with fatty liver disease. And so I'm thinking, when I'm seeing this, we're talking about burning up the visceral fat. We're talking about breaking down all body fat over time. We're talking about reducing inflammation, all the different effects I was seeing in this study. We're talking about improving digestive health with the different mechanisms of actions that can take place in the digestive system because of what the hops extract is doing in activating a particular hormone in our small intestine called CCK. Cholecystokinin is the acronym for that long crazy word there, cholecystokinin. I had to practice saying that for a while before I could actually get it to come out right. But anyway, the effects that particular peptide hormone in our intestine has on our overall digestive system, I said this is going to make a difference. This is going to be a game-changing product. But back to the fatty liver issue, that was something, because there's currently no medication for fatty liver disease. And as a pharmacist, I'm seeing all these different medications come out all the time for all these different conditions. And but there's, even though it actually is called non-alcoholic fatty liver disease that people are being diagnosed with, they're not alcoholics. They drink maybe every once in a while. Some of them don't drink at all, but yet they have the liver of an alcoholic, and or their liver's beginning to look like that of an alcoholic with non-alcoholic fatty liver disease. So When I was thinking, there's no medication, there's no drug, but these people need some help. I was doing everything I could for them nutritionally and helping them change their diet, make the correct dietary changes, trying to help reduce fat. And I said, well, this is the tool. This is going to be something that's going to help these people. And so that's what I got super excited about. And I've got my clients using it now, and we're actually seeing results with their body composition changes, with their fat percentages coming down. And I'm really looking forward to sometime in the near future when they go back for that 3-month or 6-month checkup after they've been using this product for several months, to see what their numbers look like in their blood test, to see that they have improved, that things are getting better. And so that was one of the things that excited me most. And then as I continued to do research, finding out all the other, potential effects, positive effects that this extract could have on the body, like Dr. Bowers mentioned with the inflammation. This product, this extract is a powerful anti-inflammatory, and we're seeing the results of that too, with a lot of people. But it has numerous, potential helpful benefits, not just anti-inflammation, but also is a powerful antioxidant, antimicrobial, all of these things that are properties of this extract that could potentially help people with numerous conditions that they may be suffering with. And so that's my take on it, and one of the reasons why I got so excited about it when I first found out about it.
When I looked at this and I'm going, how many systems are involved in, let's just say, obesity, just for the example. And we look at, there's 1,100 different systems in the body. And when I start looking at all the different ones, there's a good majority of them that are based upon fatty acids. And that's why they're so critical. And when we look at now 70, almost 80% of Americans themselves are in one of 3 stages of obesity. And so we call that pre-obesity, then obesity, and then severe or morbid obesity. And then you look at like 1 out of 4 in the world are dealing with this issue. There's something wrong within what's happening within those systems that break down either fats or proteins or sugars. So when I looked at this from the research, and we saw that it was going to help break down those fatty acids, it triggered a lot of things in me to start looking at, because when I look at the ability of the body to utilize fat or not utilize fat, and that's the key. If you break it down and are able to absorb it and assimilate it, it's possible to use. If you can't break it down and you can't absorb it, then you can't utilize it. And that's why it gets stored in our fat cells called adipocytes. But when we start looking at the brain itself, the nervous system, the immune system, all the different hormones that are in the body, and then you look at all those things that we mentioned earlier where fat is stored, fat is a protective mechanism. So its first job is to actually help make all the different hormones in the body. Then second of all, it's a protective layer. Every single cell has a fatty layer on the outside and the inside, which is called the lipid layer. And so when I saw that fat rancidity or free fatty acids that get inflamed, we know of over 200 different disease entities that it causes. So I said, okay, wait a minute. The first thing you're going to do when you put this in your mouth, it goes up to the brain and it makes a decisiveness of something that has to happen. It initiates an activity. And then it goes down to the stomach and it does that. Then it goes into the small intestine. Then it goes into the liver and picks up the cholecystokinin that Dr. Phil was talking about. Then it comes back up to the brain, hits back into the vagal nerve, goes back down again, and it triggers the immune system. I go, how many systems are involved here that this one single element or this combination of these 3 elements that are in there actually trigger that we've never had before? And so we're seeing all kinds of things happen from the nervous system, brain, and the control of the mechanism, all the way down to the hormones, the pain firing mechanisms, inflammatory mechanisms, the energy production mechanisms. All those things start getting better because this one system turns all those on. So think about the domino effect. If you have, the first 10 dominoes that aren't even functioning, you never get to the rest of the domino chain, no matter how long it is. But if you get the beginning of that phase to work correctly and that communication process starts, that's what interesting. The other thing that intrigued me about this is not what we call an adaptogen, where we're taking one thing and trying to convert it into something else. This is not a stimulant where we're boosting something to try to make it happen. This is an activator, which means you turn on a signal and it goes down the pathway. And that's what I found that was really, really unique. And that's why we're going to see so many different variety of things that are happening. And yet it all comes back to putting one single element inside a drink and being able to drink that. So, Dr. Phil, anything you want to add to that?
Yeah, that's fantastic. Great explanation there, Dr. Ben. Thinking about the fat and the different types of fat that we have in our body. A lot of times people think fat gets a bad rap, but but we do have good fat, and that's what you're talking about. The cellular fat, the phospholipids that are around our cells and protect our cells. Extremely important that for us to have good, healthy fats and the amounts of those types of fat that actually are beneficial and help protect us. But I think about the visceral fat, and the visceral fat is what the fat that I was talking about that builds up around those organs, and like the liver, and causes the fatty liver disease. And it's that fat is harmful. That fat is more dangerous. So we don't want accumulation of that fat. And I will say, the people that I work with that have fatty liver disease, they're not skinny. They have a great deal of fat. They have an over accumulation of fat, and that's one of the problems. And that's one of the obesity issue that we're dealing with in the world today, especially in the United States, is a major contributor to a variety of different health disease disorders and diseases that people struggle with every day. And reducing that fat, especially the harmful visceral fat, which one of the things too, we talked about the anti-inflammatory effects. The hops extract itself has anti-inflammatory benefits, but also reducing that visceral fat reduces inflammation, because the visceral fat produces these inflammatory cytokines, which cause inflammation in whatever muscle, organ, gland that this visceral fat is building up in or attaching itself to. So I think that's important distinction there. You're making with the fat and the different types of fat that we have in our body.
Dr. Phil, let's add one more quick point to that. First of all, we know that 85% of what we need for life comes in through the mouth, down that digestive pathway, right? And so if we know that our basic building blocks are proteins and fatty acids, or what we'll call a protein-fat block, here's what we find pretty interesting. When the body starts losing its ability to break down fatty acids, the next thing it starts doing is losing the ability to break down protein bonds. And then the next thing it has trouble breaking down are the mineral bonds, or the mineral pieces that are in there. When we talk about food, we talk about 4 macronutrients: proteins, fats, minerals, and carbohydrates. So if you're having trouble breaking down the 3 main things that are necessary for sustaining life and repairing life, the only category left is sugars, whether they be simple or complex carbohydrates. And that's what we're seeing, that all of these issues begin building up over time. It's not a light switch happens overnight, but over time, we lose the ability to break these things down. And therefore, the accumulation of those things starts piling up. And that's why this extract turns on the ability to metabolize everything in the stomach. And now the body is going to see a lot more breakdown, a lot more building blocks, a lot more energy for repairability than is probably seen in decades.
In all the research that I've done on the matured hops extract, I'm not seeing anything in the research warning about any particular drug interactions with any particular medications that a person may be on. All the studies I've looked at, nothing was mentioned, nothing was shown there to cause any potential problem with that. But there are some things that need to be recognized here, need to be talked about, even though there's no true drug interactions. I will say one thing: there's one particular drug that pretty much interacts with everything. And in the world of pharmacy, we've always been told to warn people, if they're taking a blood thinner, and a particular blood thinner called heparin or warfarin. Trade name is Coumadin. People are taking that type of blood thinner. They should be cautious and be aware and be careful with anything that they take. But even with that, I don't know, based upon the mechanism of action of matured hops extract, that it would even cause any problem there. But that's one I always tell people to be extremely cautious with if you're taking one of those type of medications. The old, what they call the old timey or old blood thinners. There's a lot of newer blood thinners on the market that work in a totally different way, and there's less of a problem with. But the thing that people need to be aware of when they are on medication is because of the positive effects of matured hops extract and what it can do for the body in reducing fat, also in reducing inflammation in the body. They may see, say, for example, they have high blood pressure. They may see their blood pressure coming down because they're reducing inflammation, or because they're losing weight or losing body fat. They may see something like that. If they're on diabetes medication, they may see blood sugar dropping. And those are not drug interactions. Those are tremendous positive effects that this product can potentially have on an individual as their body changes, as their health improves. Then they may have to reduce that medication. And so they need to be aware of that. Is the most important thing I would tell people to think about if you're on medication. Monitor your blood pressure, monitor your blood sugar. A lot of people that I work with, even though they're on medication and they're told, hey, you need to monitor your blood pressure, you need to monitor your blood sugar, they still don't do it.
They don't do it, yeah.
Yeah, and then all of a sudden, their blood sugar bottoms out, and they're wondering, well, what's going on? What's happening to me? I can't function anymore. I feel horrible. Well, have you checked your blood sugar? No. Well, you need to do that. So those are things I think about when it comes to medications. Not, and this is with anything, but with something as powerful as the matured hops extract and what it can do in our bodies potentially, and all the tremendous improvements that it can provide for an individual health wise, they need to pay attention to those kind of things.
So I have not seen anything that is synergistic to any type of drug, contraindications, as Dr. Phil was saying. The only side effect, and I say it's jokingly, but it's true, the only side effect I'm seeing is you're going to see your body changing. And when you have more energy production, more circulatory effects, that's going to change the dynamic of what those drugs were doing. So obviously get back with the provider that prescribed those drugs to you and make sure you're being tested and checked out. Because what we are seeing is that you're going to need less and less of those. Because as Dr. Phil said, we're cleaning up the system that was dysfunctional that you were taking the medication for. So then jokingly, I tell people the other side effect is up in the north, you're going to get cold quicker because you're losing part of your fatty, surrounding of you. All right. Which means now that things are going to flow faster and better. So really, though, there is no side effects that we have found in any of the literature. In any of the stuff that we have researched, there's no contraindications. It just works. For me, guys, when I've looked at this and now watching quite a few hundred people on this product that we've been able to actually monitor and track and see some of these results, is here's kind of what I have found. About 75 to 85% of people, we have no real issue. What I mean is they initiate it, and we'll talk about some of the ways we take it and all that here in a second. But once they initiate taking this product into their body and they give that body time to do its issues, we're seeing that within usually the first 4 to 7 days, there will be a form of detox. I tend to call it a flushing because as you clean all these systems out, you have to flush them out. Remember, there's really only 4 ways out of the body. You're going to defecate, have a bowel movement, you're going to urinate, pee, you're going to sweat, and you're going to breathe. So in one of those 4 ways, it's going to come out of the body. And the body wants to eradicate those toxins or those poisons that it's broken down from the fat rancidity. But once you get what we call flotility or motility of the body moving, now it'll be real easy for the body to continue that process. Now, there are a few people that it takes 7 to 10 days for that to happen. And even if you are more or less than that, it takes 10 to 14 days before we see that flushing or that detoxification process. Now, this isn't like a full body detoxification that we're going to look at. It's going to selectively choose where it's trying to get that out of it. And so some people we see they will urinate more for a few days until it flushes it out. Some it increases their bowel movements more, again, for a few days until it changes those. Some sweat more, and some have more foul breath, or what we used to jokingly call morning odor, breath odor. Once that gets flowing, then that process seems to decrease.
Yeah, yeah, I'll add to that a little bit. Yeah, I've had a few clients that have experienced some detox effects. They've been mild, of course, nothing nothing major. But yeah, the toxins that we're exposed to all the time, that we ingest, we breathe in, put on our skin, all the different ways that we are exposed to these different toxins get into our body. A lot of those toxins are stored in the fat cells. And so when you begin to break those fat cells down, you begin to dissolve that fat, so to speak. You're going to release those toxins, and people can feel the effects of that from time to time. And I work with a lot of people, helping them detox, and I do that now. I do chemical toxicity testing and find that quite a few people have pretty high levels of certain chemicals in their bodies that they weren't even aware that they had. And, that's why they're suffering from certain conditions a lot of times, because of those toxins. But yeah, I always encourage people, drink the water. Like Dr. Ben's talking about, with defecation, urination, you've got to hydrate your body well. Especially if there's potential toxins there, or you're experiencing toxicity effects. That hydration is extremely important, and to keep that elimination process flowing like it's supposed to.
First of all, let's talk about the classifications of people. I don't mean that in any rude way, but we have healthy people, then we have unhealthy people. And most people look at this, think they have to take it because they have excess fat in their body. But we also have people that have, different breathing issues, different hormone issues, different skin issues that aren't necessarily fat based, all right, in most people's mindset. So when we look at the individual person, here's what I found. Probably 70-75% of the people, they can afford for their body to take 1 to 2 doses a day. And here's what I mean by that. When we look at people that come to us, they're in some form of, I call it illness or sickness, meaning that there are 3 levels of obesity that we talk about. The primary level that we talk about is what is referred to as pre-obesity, which means they have a BMI, a basal metabolic index rating on their body, that they're above 25 but below 30. They're 29.9. Those are the beginning phases of lack of digestibility, lack of metabolism, which means the body's beginning to store this excess fat. Then we get into the secondary phase, which is called the obese phase, which is 30.0, all the way up to 39.9. And that's where a lot of people are starting to experience ill health. Not all the time, not every day, but they're having some issues. And then the severe or morbid obese are those that are 40.0 and higher. So when I look at those different stages of people, pretty much everybody I'm going to start on 2 a day, about 8.5 to 9 hours apart. The reason I want to do that, I want to initiate that flushing process as fast as possible so I can get their body into the repair mode. And remember, as we talked about in the previous one of the things the white adipose tissue does when it breaks down, it gives fuel for both the immune system to fight off all those toxins that are being released, and it gives building blocks to repair the dysfunction that was occurring in the first place. So as fast as I can get that to occur, I want that to happen. Now, there are a few people that are really what we call sensitive people, or they have a lot of different sensitivities, and we have to start a little slower. Then I'm just going to simply start them with 1 a day and let them kind of get their body used to seeing this element that it's not ever seen before. And it's turning all these systems on, as we say, turning on that master switch. And now everything starts being made aware of the dysfunctions, and the body has to slowly build up to that pace to start doing those works, right? Which tells me if I have somebody that it's almost too much for them at the beginning, I'm going to take them back to 1 a day and give them 1 to 2 weeks to let their body adapt to that. And then we take it back up. There are even those who are even more rare, that they have a great sensitivity or they have a great illness. Now, as a physician, what I look at on that is how can I give them a lower dose over a slower time, once again allowing their body to kind of slowly adapt to this phase so they can start utilizing all this powerful element that's in there. But those are pretty rare. I mean, we're talking about out of 100 people, we may have one or two have that. And if you think you're that sensitive person, what I do is I'll have them simply put one snap or one of the doses into 8 ounces of water and sip 1 to 2 ounces a day for 2 or 3 days, let the body see what's happening. But again, that's the rare person. Majority of people are going to be able to take one dose within the first hour of the morning, and then about 8.5 to 9.5 hours later, take the second dose, and they're going to turn on this. I call it a slow drip, where this thermogenic reaction is just slowly breaking this down over all those times, over that 16 to 18 hours. And it isn't massive effect on the body like you went out and did a massive workout, but it just slowly burns this, and it just starts melting it down, as Dr. Field said earlier. That's what gives the body the ability to turn all these things on, to create the energy to fix all these problems and continue to improve their health. So, Dr. Field, anything you want to add on that one?
No, you covered that very well, Dr. Ben. I don't think there's anything I could really add to that. That's great.
We in America tend to think, well, if a little is good, a lot is better, right? No, in this case, we don't need that. In fact, of all the different research, all things we've looked at, you can't overdo what you want this to do. The body has its ability, what we call that in that selective prioritization again, its ability to work at the level it can work. So we want to work with the body and not force the body. And once again, that's why this is an activator and not an adaptogen or a stimulator. And so when we give the body the right dosing, it will start picking this up. So for me, when I see this and I talk to one of my patients or clients and I start saying, right, as Brian just said, excuse me, that this body's taken all these years to develop this, I'm asking for anywhere from a 90 to 120 day a time frame to be on this, because I have seen in the research that given that 12 to 16 weeks is when most bodies finally catch up, and we start seeing some pretty dynamic results down that pathway that we'll get into here in a moment. So if I have someone who has, let's say, a lot of health conditions in the body, I know that this is not going to fix everything in that 90 to 120 days. So therefore, they're going to probably need to be on this 6 months, 9 months to a year to fully get the body to engage, to fully go through all these processes and clean all this stuff up. And then we start looking at, okay, well, how long does a person take this? Do they take it till they get to their desired body shape, body style, the feeling? I don't say the scale, although everybody wants to go look at that aspect of it. But when they reach a level that they're going, wow, this is the greatest I've ever felt, or the best I've felt in 5 or 10 or 15, 20 years, what do you want to do to stay there? Now, that may be a different phase we talk about in the adaptive phase, where you might reduce it down to one a day. But for the most of us, 80% of Americans that we know of that have this problem, they're going to be on this for a while at that double dose to make them get the results that they need. The second thing I want to add into there, that we'll talk about what's called an acclimatory rate. And what I mean by that is the body kind of cycles in and out. Specifically, when we talk about fatty acids, about every 90 days, the body is doing an adaptive process. So if we look at the first 90 days as the initiation phase, that things are kind of turning on, and it's kind of like turning the lights on in a building. You know, you didn't just turn on one or two, you turn them all on. Now the whole body sees what needs to be done. But it's going to go back to that selective prioritization process. It's going to say, I'm going to start fixing on this one first, where I have the least resistant. Then I'm going to fix the next one, where I have the next least resistance. And in time, all that's going to add up. And then it's going to say, okay, we got the first phase done. Now let's go to the second phase. And we see this in the neurology and the endocrinology aspect of that, of how the body is measuring what's happening to itself, and it's staging or phasing its repairability phases. And so when I look at that aspect, for most people that have had this problem for years, it may be 6, 9, 12, months, whatever, before they kind of reacclimate to every one of those changes that are going on.
Yeah. That's very good, Dr. Ben. Yeah, I always tell everybody that I work with and the health coaching that I do, you got to give it time. And like we mentioned a moment ago, everybody's wanting that quick fix pill. They want it now. They want results right now. But you got to give it time. And I use the same time frame. Pretty much Dr. Bauer was talking about 3 to 4 months. At least give anything that I recommend. The matured hops extract, any other particular supplement that's potentially going to correct things or help fix things, so to speak, in a person's body that they're dealing with, they got to give it time. And some medications out there you can get super fast results with. People take, and this is what it's kind of spoiled a lot of people. They take a medication and they begin to get results in a day, 2 days, 3 days. But with natural products that take time to work through the body, work through the systems, and for our bodies to take these things in and make the cellular changes that they're going to make in the body, that takes a little bit more time. They don't work. They're not fast acting. Most natural products are not. And so I encourage people, be patient, give it time. Like we said, you didn't get in this shape, overnight. You're not going to get out of it overnight.
I just woke up one day and I was like this. What happened?
Oh yeah. Oh yeah.
Hey, Dr. Phil, let me ask you a question in regards to that aspect, because I love how you just said that. And the issue is that most drugs, they are adaptogenic stimulatory. They are designed to do something unique. And generally that's to reduce symptomatology, right? But they're not truly, and correct me if I'm wrong on this, but they're not really designed to repair or fix anything per se, right? It's just to make a change within the body that is quickly felt. And I love how you said that the natural products, they're going in and they're trying to break down the dysfunction and to repair the body's ability to build back up correctly. And that's the beauty of what we see in this. So I appreciate you bringing that out.
Oh yeah. Yeah, that absolutely. Yeah. The medications, most medications on the market today are designed and developed primarily to manage disease, not to reverse it, not to help cure, so to speak, if you want to quote unquote cure, but they're manage the disease. They're designed for management. They're designed to relieve symptoms and not to correct physiological processes and stabilize things and modulate things in our bodies that can help totally reverse a disease or a condition that a person has.
And when you look at if we just kind of say the class of weight loss drugs that are out there, right? And what we know from the research is the moment you get off those, guess what? It all comes back plus some, right? And in a lot of things, that's what's happening. The uniqueness about this element that's coming from this mature hops extract is that as it goes in and cleans all that up, it repairs the body and the systems that are dysfunctional. And those are the things that we will be seeing. The long-term effect of this is the body will stabilize in the new health phase or health state and not go automatically back. And that brings up one really quick thing we'll talk about probably in the next one, but how it changes the dynamic of the awareness of the brain to control and operate that at a new phase or a new state. And that's exciting.
Awesome.
Yeah. Yeah, that's very good, Dr. Mann. And I think I may mention one thing here too, in reference to what we've been talking about, especially what I mentioned about everybody's looking for a quick fix, and the drugs medication sometimes can provide a quick relief of symptoms. I think be doing a disservice to people if we didn't mention that even the power of this matured hops extract and all the powerful things it can do and the positive things that it can do. When a person is struggling with obesity, diabetes, high blood pressure issues, especially if it's in reference to weight gain or excess body fat, you've got to do the right things dietarily as well. You got to make the right choices. People who think, well, I can keep eating all this junk food I eat every day, and I can keep going to the fast food restaurants and eating junk, and this product's going to work. I would discourage people from those kind of thoughts. You may get some results in the beginning, but you don't want to continue down that path of eating toxic foods on a regular basis. I tell people, that's one of the things I do as a health coach. I help people clean up their diets and make better choices nutritionally. And what I've seen with people who do that, adding this particular supplement along with a good, sensible dietary program and exercise program, they're going to get even better results, even faster results. And they want to get from point A to point B faster. add in the dietary component and the fitness component, and that'll get you there faster.
So one of the things when I first looked at this as a functional medicine physician, my point was, okay, what can I expect to see or observe in patients or clients as they start on this product? And I knew a couple of things. First of all, I knew it wasn't probably going to be weight. And the reason I make that statement is when you look at the weight on a scale, what weighs the most? It's going to be water, then it's going to be muscle, then it's going to be bone, and then it's going to be fat. So I knew if we started losing fat, we probably wouldn't see much change on the scale. And that would probably be somewhat discouraging to people. So I went back into my training and said, okay, well, let's start measuring different things so we can see what's happening. So the first thing we did is, since we knew that this was going to affect the brown adipose tissue, and we know that brown adipose tissue in adults is basically up around the neck, the clavicle, some in the brain, some down around the lungs, some around the digestive pathway, all the way down into the stomach area and into the viscera. We knew that probably the first thing we would see as this initiated that burning, that thermogenic reaction, we would probably see changes happen in those areas first. So I went in and we looked at 18 different areas on the body that we could measure. And so we could start watching what happens with this. Now, a couple of interesting things here, and we touched a little bit about this on one of the previous episodes, was we didn't ask people to change their diet, right? We asked them just to do what they're currently doing, and let's watch and see what happens. Now, the first thing I expected it would be what I call the head body disconnect would reconnect. And what do I mean by that? Is that we're all used to sitting down to a meal and filling up a plate of food or bowl of whatever, and we kind of know the amount that we need to eat, right? That we're used to eating. And if I anticipated what this was going to do by shutting off that stomach, I knew probably the first thing we was going to see is that they couldn't continue to eat that amount of food. So that was one of the first things I asked my patients and clients to do is watch that connection and see what's happening to the amount of food that you're eating. And sure enough, they say, wow, I get full quicker and I'm eating a lot less food that we're doing. Now that triggered something in the brain that we're going to come back to here in just a minute. But then they started noticing, since they were eating less, but the body was breaking down a lot more of that food now, that the leptin hormone inside the brain, which gives us what we call satiety, meaning I'm full, time to stop eating. They were eating less and breaking it down, and that amount of food being totally digested or metabolized was then being pushed through the system. Now they have a lot more fuel than they were ever getting before. So that was the first thing we saw. The second thing we were going to see then all of a sudden they're going to have more energy more often and have more stamina. And then they were going to notice that they were eating less times, meaning most people would eat, a couple hours later, they have a little snack, a couple hours later, they have another meal, a couple hours later, another little snack. And all of a sudden they should see that reduce. And that's exactly what we saw. So kind of at the end of that phase, when I was looking at this, they were going to be eating less food, less often, and less amounts for the day that they were used to, because the head body connection was being reconnected. And we talked about that master switch being turned on, and the body was aware of what was happening. The next couple of phases we started seeing, and if all that was happening, then we should see that the efficacy of the bowel movement would change, meaning that all of a sudden they're going to have less bloating, they're going to have easier bowel movements. We're going to see all those changes dynamically happening in their body. And they would get more either odoriferous or smelly bowels, but eventually the bowel would clean up and we'd get good flow, good motility going to that bowel. Now, then I came back and said, okay, well, if we have more energy going around, we're going to get into the blood system. We're going to start cleaning the blood up, right? And we're going to get those fats broken down, as Dr. Phil mentioned earlier. Now we're going to see that the blood pressure start changing, which means now we're going to see a change in the terms called cardiac output, which means that the heart is going to be able to pump easier and not go fast, not go slow, not have problems. Then we're going to see something pretty unique, and that was the sleep. Because most people aren't really aware of what happens while they're sleeping. And we know that sleeping is a critical component because we have to repair while we're sleeping. That's why we get tired in sleep. So one of the things we start seeing is that they should be doing a couple things should change. Number one, they should get into a deeper sleep, a more restful sleep, and they should wake up less. Now, funny thing I didn't notice at first, I didn't think about this. all of a sudden we're seeing that they start snoring less as well. And a lot of people aren't getting up and going to the bathroom 3, 4, 5 times a night, which now that's giving them better sleep, deeper sleep, and they're waking up less tired, less irritated, less frustrated, and they have more energy. And a lot of us didn't really see that at the beginning, but that was kind of the outcome that we started seeing. Then we saw a lot of other things, and I'm going to touch on this. I'm going to turn it over to Dr. Phil. But a couple of unique things started happening. A lot of people started having less pain, less headaches, less weakness, less numbness, and mentally, cognitively, they started thinking better and more clear, had better recollection. They felt happier, and all of a sudden they are having less stress, less anxiety. The moods are improving. For women, the menstrual cycles were changing. All of a sudden, all those things just start cleaning up and start getting better. And one of the things I want to touch on, what Dr. Field mentioned in one of the previous episodes, was all of a sudden people start thinking differently, meaning they don't go for all that fast food. All of a sudden they're making better choices because now they're going, wow, I'm feeling better. And I know that if I eat that junk food, all that bad feeling comes back on. So selectively now in their thought process, they're choosing to go eat better. And another unique thing that started showing up that we didn't anticipate is all of a sudden they're going, I have so much energy, I need to do more stuff. Meaning they're getting up off the couch, they're going on outdoors, they're getting on their bikes, they're getting on the treadmills, they're cleaning things up. All of a sudden, this whole aspect of dynamically change inside the body, they start thinking different. And all because they start feeling better. And that was a pretty unique change that I didn't anticipate, but we're seeing a lot of that. So, Dr. Phil, what are some things you're seeing, sir?
Yeah, absolutely. That's great stuff, Dr. Ben. But I'll start with my own, personal. The first person that started taking this product when it came out in relation to me was me and my wife. And so we both got started on it before I even recommended it to any of my clients. And of course, my wife, I'll tell about her first. After a couple of weeks, she said, I don't think this stuff is working. I said, yeah, it is. You just keep taking it. It's working. Don't give up on it. Keep taking it. And she came to, a couple weeks later, she says, I don't know if this stuff's working. She said, I'm not losing any weight. I'm not seeing the scales go down. I said, well, look, go get your measurements for me. I said, you took your measurements before you started, right? She said, yeah, I got my measurement. I said, go measure. She came back, she went and measured, she came back, she said, wow, I've lost 3 inches in my stomach and 1 inch in my waist. She didn't realize it. I did, I could see it, but she couldn't see it. And she's continued to, but that was about a month in. And the weight still was not coming off. The weight has recently started coming off. The scales are starting to come down. And this is 2.5 months or so in, almost 3 months, and the weight's starting to come down. Like what you were referencing earlier, Dr. Ben, about the 12-week, 16-week studies. So it's beginning to happen, and that's what everybody's different. Everybody's body's different, different metabolism, different things, different toxic levels, all these different factors that can come into play that can affect how quickly things respond. Now I have a son, my oldest son, he started on it a couple weeks after we did. And he calls me the first week. He said, wow, I've lost 6 pounds this week. That kind of stuff, we see that kind of stuff too, but it's different with everybody. And I've had numerous other people text me or call me and say, hey, I can't believe how this stuff is working. I've lost 4 pounds this week, 5 pounds this week, that kind of stuff. And then I've got others say, I don't think it's working. I'm not losing anything. And so stick with it. But as far as myself, one of the I don't have a lot of excess body fat. I've got a little bit, little love handle. I'd love to see go away. And I believe it will at some point. It has gotten a little bit smaller. I'll say that. But I'm my ideal weight for my size and my height. I don't need to lose any weight. And I wasn't really taking it for that. I just wanted to see what effects I would get from, what kind of benefits I might get from it. And it was a little over a month in after taking it. I tell people I woke up one morning and realized I didn't get up to go to the bathroom but one time that night. And I had been going 4 or 5 times every night.
Yep.
And so I said, wow, what is going on here? This is incredible. And the next night, one time, the next night, 2 times, the next night, 1 time. And that was several weeks ago. And that positive effect and benefit has continued over the past several weeks. And but when it first happened, I said, I don't, what's going on here? This is a visceral fat burning product. It helps with digestive, function, has all these different functions, but what's it doing to my prostate? Because that's why I was getting up going to the bathroom every night, because of a condition called pHix, that my prostate was inflamed. And and so I started digging into the research to see if I could find something in relation to that. And I found numerous articles, studies talking about visceral fat building up around the prostate, in the prostate, causing inflammation, excreting these inflammatory cytokines that cause inflammation. So I said, that's it. That's got to be it. And I even found articles talking about the connection between prostate cancer and excess body fat. And so I said, well, this is super exciting for me. I want to keep doing this for sure. And then I've got clients that come to me and said, I have so much more energy. I've got a lady that came to me a week or so ago. She says, whatever you do, don't let me run out of this stuff. She said, I feel so much better. She said, my swelling and inflammation has gone down. And she's telling everybody about it. She said, she said, I'm telling everybody, you need to call Phil Carson. You need to start taking this stuff. And so I love that kind of thing. And another thing too, the cognitive benefits. I'm hearing people talk about that. Dr. Ben mentioned that. And there's even studies out there that with matured hops showing that there are positive cognitive benefits a person can have. And that's a whole other realm of things we could get into. Won't get into today, but the reduction of inflammation is something I am getting a lot of people responding about, how their inflammation has decreased and they're feeling so much better.
So let's add one more category in here, Dr. Bill. So for those that don't have, let's say, an obesity or fat issue or an inflammatory issue, and let's kind of go into some of the youthfulness here. So before I do that, I want to talk about the athlete phase. So we have a lot of what I call weekend warriors out there that they do a lot of stuff over the weekend and they get the inflammatory issue. And so we're seeing great results in those as well. But the athletes themselves, and I'm talking about professional athletes, we have them in basketball and golf and football and soccer and baseball. And all these ones that I actually have on this for watching, we're getting more defined muscles, right? Because we're breaking down the muscle adipose tissue. We're getting better cognitive awareness in what's called spatial awareness. We're getting better hand-to-eye coordination. We're getting better breathability, or the VO max, the body's ability to perform better and longer, right? Because this inflammatory stage isn't turning into fat rancidity and causing all of the inflammatory issues. And so for me, when I look at almost any age, and we looked at the research, and the research says even 2 to 5 year olds that have weight-based issues, since this is a natural product and it doesn't interrupt or interfere with any known system, but as we said earlier, it turns on the switches to make them start working better, we're seeing real unique changes even in the younger ages, right? And even into those that are going through adolescence and pubescence, and how we're having dysfunctions within different cycles and all different phases, both male and female. All of a sudden, because these are cleaning, or this is cleaning up the systems, and the body's going back to its God-given created design to start repairing those things, we're seeing phenomenal things. We're seeing skin grow. We're seeing hair grow. Well, maybe not on Byron, but I'm just kidding. But we're seeing a lot of things happen. Right? That all of a sudden you didn't expect that. Yet we kind of knew, and we really expected that to be in the long-term aspect into the 6-month phase. but we're having what I call the freaky side or the miraculous side. Meaning we're seeing some things that are almost mind-boggling to those of us in functional medicine. We're going, wow, that happened way too fast, right? I mean, just phenomenal results of things that you'd go, is that really happening? Is this thing really doing it? That made us go back in and dig more and more into that research to understand it. And here's what I know. If we get man and its problems out of the way, the God-given ability of that body, the way it was designed to identify and correct and repair and regenerate health, no matter the age, it's going to make a big difference. And as a guy who does a lot of epigenetic work or DNA work, and I read all that stuff, and I go back and find how this is turning on things that have been turned off, it becomes real phenomenal. So we're seeing a lot of things change in here. Right. And you can get the download, the list of all the different things we've been watching and monitoring. And the reason I encourage you to do that is kind of like what Dr. Phil's wife was saying. And we've had a lot of people go, I've been on this 4 weeks and I don't feel any different, maybe 1% better. And you're going, really, let's go through all these different things and let's see what you notice. We were at a conference and the gal, I was talking about headaches, and she looks at me kind of dumbfounded and she goes, wow, I used to have migraines about 4 or 5 times a week and I've not had any in 2 weeks. I go, how could you not recognize that? But once you do that and the body turns all those pain firing mechanisms off and you clean it all back up, you're going, wow. Now we saw that, we've seen that quite a bit. And so it's really phenomenal, all the different things that are out there. So when I start people or clients or patients on this, I go, listen, I don't know what on this list you're going to have, but I know somewhere in the next 4 to 8 weeks, one of these things is going to make some dynamic change in your body. And you're going to start feeling better and you don't even know it. But like Phil said, Dr. Phil, those around you, they'll see that less frustration, irritation, anxiety, and stress in that irritated phase of the body. And you just start slowly feeling better over time. You don't notice it. So it's really phenomenal what we're seeing here. But let me add one thing is I simply encourage the listener. Your body is screaming for something. Right. And this has no issue. It's natural. It's not going to make something good bad, right? From my perspective. And what it's going to do is going to allow you to change you. So I want to encourage you to give yourself and your body and whatever your health issue is, if you have one, give it the time and use this product and watch what happens over time. Of my 40 years of being in healthcare, specifically in functional medicine, specifically in DNA aspect, and understanding why bodies go wrong, I want to say you owe it to yourself. I don't mean that in any way funny, but give it to yourself and let the God-given ability of the creator of your body use a supplement or an entity, an element that he designed to fix your body. You owe it to yourself to give it that time to do that. That's what I'd encourage you with.
Great stuff.
Yeah, absolutely. And I'll add one thing here to that as well. It made me think about Dr. Ben and what you were just saying. Back in when I had one of my pharmacies I had years ago was an integrated natural pharmacy, and I had a scripture on the wall. I had an artist come in and do this cool looking artwork and put the scripture on the wall in my pharmacy above the supplement section and the herbal, natural, all the natural products section I had in my store. And she did a great job painting this on the wall. And it was, and God said, behold, I have given you every herb yielding seed, which is upon the face of all the earth, and every tree in which is the fruit of a tree yielding seed. To you it shall be for food. Food is medicine.
Yeah.
And so God's given us this medicine, and I'm grateful for it, and I'm thankful to see what it's doing for not only me, my family, but also for my clients.